myself Dr. Hariharan. First topic in the upper limb. So you can take the page 123, page number 123. Okay, so that is where the upper limb starts. So I think you guys can take the upper limb page, and we are straight away starting with the brachial plexus. Okay, so see, when you talk about upper limb, okay, lot of questions have come in this area. Okay, in the past years lot of questions have come in this area. So it is very very important. Okay, so we have, in the workbook, we have chosen those important topics, and we are going to discuss about those important topics here in the workbook. Okay, so few things uh, we might not be able to cover in these 4 days. I think that will be simple things that you guys can easily study. Okay, so without wasting much of the time, and again, good morning to all the newcomers who joined the channel. We are starting brachial plexus. Okay, see, before going into brachial plexus, I want you guys to understand a simple thing. Okay, so if you see the spinal cord, okay, if you see the spinal cord, okay, so the spinal cord has got a structure like this, guys. Okay, so it has got a structure like this. Okay, so it has got two enlargements in it. Okay, yes, it has got two enlargements. So there is an enlargement here and there is an enlargement here. Okay, in the spinal cord you got two enlargements. I hope you know these two enlargements. Can anybody tell me the first enlargement, which is seen towards the cranial side? Yes, what is this enlargement called as? Yes, what is this enlargement? This enlargement is called as the cervical enlargement. Very good, guys. This is called as a cervical enlargement. Very good. And this is called as a lumbar enlargement. Okay, this is called as a lumbar enlargement. And if you watch very closely, from the cervical enlargement, the nerves which arises, the nerve roots which arises from the cervical enlargements goes to the upper limb, and from the lumbar and from the lumbosacral enlargements, the nerve roots will go to the lower limb. Okay, will go to the lower limb. Suppose if I make a section or a cross section of the spinal cord at this level, okay, at the cervical region, okay, I'm just making a cross section. Okay, if I make a cross section at that level, okay, you will see the spinal cord cross section like this. Okay, so this is the cross section of the spinal cord. I hope you guys would have seen this right from your school days. Okay, there is no doubt in it. Okay, and in the spinal cord, okay, you have got the inner gray matter. Okay, you have got the inner gray matter. Okay, so which is in the form of letter H shaped. Yes, it is in the form of letter H shaped. This is the inner gray matter, and in the center of the gray matter you have got a canal which is called as a central canal. Okay, this is a cross section of the spinal cord. Okay, if you observe the spinal cord, okay, the gray horn has got the gray matter has got two horns. One is the anterior, okay, horn. This is the anterior horn, and this is the posterior horn. Yes, this is the anterior horn, this is the posterior horn, and this posterior horn is sensory in nature. This posterior horn is sensory in nature, and this anterior horn is motor in nature. This is called as motor in nature. Okay, from the anterior horn or from the motor part, okay, you got the ventral rami. Okay, and from the dorsal part, okay, so you got the dorsal root ganglion. Okay, okay, and from the dorsal root ganglion, okay, so you have got the sensory part entering the spinal cord. Okay, so if I take a cross section of the, okay, if I take a cross section of the spinal cord, okay, if I take a cross section of the spinal cord at the cervical level or at the lumbar level, I can able to see the gray horn inside, okay, the gray matter inside and the white matter outside, and this gray matter has got the anterior horn which is motor in nature, and the posterior horn which is sensory in nature. Okay, now these two rami, okay guys, these two rami join to form, okay, the spinal nerves. These two rami join to form the spinal nerves. Let us consider, I have taken a section at the C5 level of the spinal cord. So what is this nerve root represents? This represents the C5. Okay, so this is the C5 spinal nerve. This is the C5 spinal nerve. Yes, very good. This is C5 spinal nerve. So if I take the C5 spinal nerve, you can see there is a sensory component here and there is a motor component here. There is a sensory component here and there is a motor component here. So this nerve is a mixed nerve. So what is this nerve called as? This nerve is called as a mixed nerve. So the nerve which arises from the C5 level is a mixed nerve. It has got both the sensory component in it and it has got the motor component in it. Am I clear? So if I take a section at C6 level, if I take a section at C7 level, if I take a section at C8 level, T1 level, at all these sections I will get these kind of spinal nerves. Are you clear in this? Yes. So when I see the spinal cord, I can able to see the enlargements. Okay, so I can able to see the enlargement. The topmost enlargement is called as a cervical enlargement, and the enlargement which is seen below is called as the lumbar enlargement. When I make a cross section of the spinal cord, I can able to see the gray matter inside, which has got two horns. One is the anterior horn, another one is the posterior horn. Okay, so at this moment I just want you to ask one more thing, guys. I just want you to ask one more thing. Is there any other additional horns present in the gray matter? Can anybody tell me? Can anybody answer this question? Is there any other horns which is present in this cross section, guys? Any other horns which is present in the, we have seen anterior horn, we have seen the posterior horn. Yes, very good, Divya. It is called as lateral, also called as the intermediate gray horn. Very good. So you have a projection like this in the thoracic level, okay, where you have an additional horn called as the intermediate horn, also called as the lateral horn. Very good, guys, very good. So if I take these horns, from the anterior horn you got the motor root, and from the posterior horn you got the sensory root. Okay, so this is the sensory root. So this is the sensory root. Now these two join form the spinal nerves. So basically the spinal nerves are mixed nerves. Now you consider this as the root of the brachial plexus. This part is called as the root of the brachial plexus. So if I take the brachial plexus, how brachial plexus is formed? Brachial plexus is formed by roots of C5, C6, C7, C8 and T1. C5, C6, C7, C8 and T1. Guys, remember, all these are mixed nerves. All these are mixed nerves. So they have got both the sensory and the motor component in it. Now these roots, okay, join to form the next portion of the brachial plexus, that is the trunks of the brachial plexus. That is the trunks of the brachial plexus. Yes. Okay, so the root C5 and C6 joins to form the upper trunk. Okay, the root C8 and T1 joins to form the lower trunk. C7, it does not joins with anyone and it forms the middle trunk of the brachial plexus. Middle trunk of the brachial plexus. Okay, so we are starting with the formation of the brachial plexus. Brachial plexus has got certain parts in it. The first part is the roots of the brachial plexus. So what you see here is the roots of the brachial plexus. The roots of the brachial plexus are formed by the following nerve roots: C5, C6, C7, C8 and T1. Of the C5 and C6 joins to form the upper trunk, C8 and T1 joins to form the lower trunk, C7 does not joins and it continues as the middle trunk, okay. The next portion of the brachial plexus is the division of the trunks. So the trunk divides into anterior division and posterior division. Each of the trunk divides into anterior division and posterior division, guys. Okay, is it clear? So the trunks divides into anterior division and posterior division. So what are these? These are called as the divisions. Yes. Okay, so these are called as divisions. Now what these divisions do? These divisions intermingle with one another and forms the next part of the brachial plexus, that is the cords of the brachial plexus. Okay, clear? Cords of the brachial plexus. Fine. Okay, so if you see the cords formation, the lateral cord, okay, is formed by the union of the anterior division of the upper trunk and the anterior division of the middle trunk. Okay, is it clear? So how the lateral cord is formed? Lateral cord is formed by the anterior division of the upper trunk, okay, anterior division of the upper trunk and by the anterior division of the middle trunk. So obviously the lateral cord will have a root value of C5, C6 and C7. Why? Because the upper trunk is C5, C6, the middle trunk is C7. It is formed by the anterior division of the upper trunk and the middle trunk. So the root value of the lateral cord will be C5, C6 and C7. Now what is the anterior division that is left? The anterior division of the lower trunk is left behind. The anterior division of the lower trunk forms the medial cord of brachial plexus, which has got the root value C8 and T1, which has got the root value C8 and T1. Now what is left behind further? All the posterior divisions are left behind. So all the posterior divisions are the posterior divisions of the upper trunk, posterior division of the middle trunk, and the posterior division of the lower trunk. They all join to form the posterior cord of brachial plexus. So posterior cord of brachial plexus will carry the root value of C5, C6, C7, C8 and T1, guys. Yes, okay, fine. Am I clear on this? So the formation of brachial plexus, we are seeing about the formation of the brachial plexus. Brachial plexus has got following parts in it. One is the roots, another one is the trunk, another one is the division, another one is the cord. Okay, from the cords you got lot of branches. We will discuss that in a short while, but basically you should understood what is brachial plexus and how brachial plexus is formed. So brachial plexus is a bunch of nerves which supplies the upper limb. Okay, brachial plexus is nothing but the nerves which supplies the upper limb is called as the brachial plexus. Nerves that supplies the upper limb is called as brachial plexus. Okay, okay, clear? If there is any compression of these nerve roots at the exit level, okay, it causes a radiating pain to the upper limb. It causes a radiating pain to the upper limb. We call that as brachialgia. We call that as brachialgia. I hope you would have understood the sciatica pain which happens in the lower limb due to the compression of the lumbosacral plexus. Similarly, compression of the nerve roots which goes to the upper limb, when it gets compressed, we can have a similar radiating pain to the upper limb, and we call that condition as called brachialgia. We call that condition as brachialgia. Okay. Now coming back to brachial plexus. Now when you see the brachial plexus, this is one way of dividing the brachial plexus. Brachial plexus is divided into roots, trunks, divisions, cords and the branches. Okay, clear? So the other way of dividing the brachial plexus is the supraclavicular portion and the infraclavicular portion. I hope you all guys knows the cervical portion of the spinal cord is here. Okay, it is here, isn't it or not? The cervical portion of the spinal cord is in the neck region. So all this brachial plexus roots arises from the neck region and they travel into the upper limb. Okay, so just remember, when they come from the neck, when they go to the upper limb, they cross the clavicle. Okay, they go through the axilla and enters the upper limb. Okay, so if you take the clavicle as a landmark here, whatever portion of the brachial plexus above the clavicle is called as supraclavicular part. Whatever portion of the brachial plexus below the clavicle is called as an infraclavicular part. Okay, so I am just arbitrarily drawing the clavicle here. Okay, I am just drawing the clavicle here. Okay, so this represents the clavicle. So whatever portion before or just above the clavicle is called as the supraclavicular portion, and whatever is below the clavicle is the infraclavicular portion. And from this diagram, if you see clearly, the roots and the trunks forms the supraclavicular part of the brachial plexus. They form the supraclavicular part of the brachial plexus. The cords and the branches forms the infraclavicular part of the brachial plexus. Okay, so they form the infraclavicular part of the brachial plexus. Questions have come from these areas. They will give you 4 nerves and they will ask you what is the nerve which arises from the supraclavicular portion. Okay, what is the nerve that arises from the supraclavicular portion, or they might ask what is the nerve that arises from the infraclavicular portion. So this question have come in the previous exams. Okay, in the INICET and in the NEET PG, this question have come. So you should know what are the portion of the brachial plexus which are above the clavicle. So this is the supraclavicular part, that is the roots and the trunks, and the infraclavicular portion of the cords and the brachial plexus. Cords and the brachial plexus. Yes, very good. So guys, I think you are with me. So we are discussing about the brachial plexus. We have seen about the parts of the brachial plexus. Now we are going to see the nerves which are arising from the brachial plexus. We are going to see the nerves which are arising from the brachial plexus. Okay. See, when you see the nerves, there are a lot of nerves which arises from the brachial plexus. There are a few mnemonics to remember that. Okay, so we'll just start with one by one. Okay, so we'll start from the root. Yes, so in the root, if you see, from the C5, okay, from the C5 you have a nerve which arises and goes to the scapular region, and this nerve is called as the dorsal scapular nerve. So this nerve is called as the dorsal scapular nerve, okay. So this nerve is called as the dorsal scapular nerve, okay. So this dorsal scapular nerve runs to the scapular region, and it supplies the muscles around the scapular region. I will tell you what are the muscles that are supplied by the dorsal scapular nerve in a short while. Okay, so the nerve which arises from the root, that is from the C5, is dorsal scapular nerve. In a similar way, there is a cervical plexus just above this region. So from the cervical plexus you take the C3, C4 and the C5 root. So C3, C4 and C5 root, they join and form an important nerve, very important nerve. So from C3, C4 and from the C5 part of the brachial plexus, contribution goes to this nerve. And can anybody tell me the nerve which has got root value C3, C4 and C5 that supplies the diaphragm? Can you tell me what is the nerve that is supplying the diaphragm? Very good, Preeti. It is the phrenic nerve. It is the phrenic nerve. It is the phrenic nerve. Okay, it is the phrenic nerve. So from C3, C4, they are not part of the brachial plexus, but C5 is a part of the brachial plexus. So from C5, the rootlets join C3 and C4 and forms the phrenic nerve Okay, what a very important nerve because it supplies the diaphragm. You all know how important the diaphragm is. Okay, and from the C5, okay, and from C6 and from C7. Okay, so remember guys, C5, C6 and C7 joins to form a nerve called as a long thoracic nerve. They join to form a nerve called as a long thoracic nerve. Okay, long thoracic nerve is also called as nerve of Bell. Okay, long thoracic nerve is also called as nerve of Bell, and this long thoracic nerve runs on the medial wall of the axilla. The long thoracic nerve runs along the medial wall of the axilla, and it supplies an important muscle on the medial wall of the axilla, and that muscle is serratus anterior. Okay, so long thoracic nerve supplies serratus anterior. Long thoracic nerve supplies serratus anterior. So long thoracic nerve arises from where? It arises from the roots of the brachial plexus. And what are the roots that are involved in it? C5, C6 and C7 guys. C5, C6 and C7. Okay, so these are all the important nerves which arises from the brachial plexus roots. See, apart from this, there are small contribution from these rootlets to the paraspinal muscles, mainly the longus colli muscle, mainly the longissimus capitis muscle. So all these muscles are supplied by these plexus, which are not much important here. These three nerves are very important to know from the roots of the brachial plexus. One is the phrenic nerve, which has got root value C3, C4 and C5. Dorsal scapular nerve, which has got root value C5. Yes, dorsal scapular nerve which has got root value C5, and long thoracic nerve which has got root value C5, C6 and C7. As I already told you, long thoracic nerve is also called as nerve of Bell. Long thoracic nerve is also called as nerve to serratus anterior. So nerve to serratus anterior per se says that this supplies the serratus anterior muscle. We will discuss about serratus anterior muscle when we come to the muscle part of the upper limb. At this junction, we will stay with this. Okay, so next portion of the brachial plexus is the trunk of the brachial plexus. Okay, so how many trunks are there? There are three trunks. One is the upper trunk, middle trunk and the lower trunk. Okay, of these trunks, okay guys, of these trunks, only the upper trunk gives rise to branches. The middle trunk and the lower trunk does not give any branches. So from only from the upper trunk you got branches. So there are two branches which arises from the upper trunk. There are two branches which arises from the upper trunk, guys. There are two branches which arises from the upper trunk. The first branch is the suprascapular. Now the first branch is the suprascapular. Now okay, so this is suprascapular nerve here. This is suprascapular nerve. Yes, this is suprascapular nerve, and the nerve which arises and runs slightly below underneath the clavicle is nothing but the nerve to subclavius. This is nerve to subclavius. This is nerve to subclavius. Okay, this is nerve to subclavius. So you got two nerves which arises from the upper trunk of the brachial plexus. One is a suprascapular nerve, another one is the nerve to subclavius. Okay, suprascapular nerve supplies, it goes to the scapular region. Okay, it goes to the scapular region and it supplies two important muscles. One is the supraspinatus, another one is the infraspinatus. Okay, I'll just try to accommodate that here. Okay, I'll just erase this area. Okay, so that you can able to appreciate where the suprascapular nerve is. Okay, so if you see the okay, if you see the scapula, if you see the scapula, so this is the scapular region. So you have got the superior border of the scapula, this is the suprascapular notch. So this is the lateral portion of the scapula, this is the medial portion of the scapula, and this is the inferior angle of the scapula. Okay, so what is this? This is the lateral border of the scapula, this is the medial border of the scapula, this is the superior border of the scapula. Okay, so in the superior border of the scapula you have got a notch, this is called as the suprascapular notch. What is this notch called as? This is called as the suprascapular notch. Okay, so this suprascapular notch is bridged by a ligament. The suprascapular notch is bridged by a ligament. Okay, so below the ligament, okay, the notch, because of this ligament, is converted into foramen. This is called as the suprascapular foramen nerve, and through this foramen the suprascapular nerve enters. Through this the suprascapular nerve enters. Now I am just going to draw another landmark here. Okay, so if I draw a landmark like this on the dorsal aspect of the scapula, okay, you are going to tell me what is this landmark which is present on the dorsal aspect of the scapula called as? Yes, anybody? So this is called as the, very good, this is called as the spine of the scapula. And what is this? This is called as the acromion of the scapula. This is called as the acromion of the scapula. Now if you see guys, the suprascapular nerve enters a fossa above the spine. What is this fossa called as, guys? Can anybody tell me what is this fossa called as above the spine of the scapula? Okay, above the spine of the scapula, this fossa is called as the supraspinous fossa, and below the spine of the scapula you got a fossa called as the infraspinous fossa. I hope you know there is a muscle in this area in the supraspinous, in the supraspinous fossa, and there is a muscle in the infraspinous fossa. I hope you all know these muscle. There is nothing to discuss much about this muscle. The name itself says it is present in the supraspinous fossa, it is supraspinatus muscle, and that is present below the spine, it is, and the infraspinous fossa, it is infraspinatus muscle. Now can anybody tell me the nerve supply for supraspinatus and the infraspinatus? Yes, can anybody tell me what is the nerve supply for supraspinatus and infraspinatus, guys? Yes, what is the nerve supply for supraspinatus and infraspinatus? Anybody? Yes, very good, very good, Manimaran, very good. So the nerve which supplies supraspinatus is the suprascapular nerve. Nandini, it is not supraclavicular nerve, it is suprascapular nerve. Okay, Manimaran, very good. So if you see the suprascapular nerve supplies the supraspinatus, then it runs through the spinoglenoid notch and it supplies the infraspinatus muscle also. Okay, so where is this nerve arising? This nerve is arising from the brachial plexus. From which part of the brachial plexus? So it arises from the upper trunk of the brachial plexus. Okay, so it runs posteriorly, reaches the scapular region, it runs below this ligament. Okay, that is nothing but the transverse scapular ligament. So what is this ligament called as? This ligament is called as transverse scapular ligament. This is called as transverse scapular ligament, and below the ligament the nerve enters the supraspinous fossa, and it supplies the supraspinatus muscle, and then it runs to the infraspinous fossa and supplies the infraspinatus muscle. Why I am telling more about this or more about this area is, this area is where the suprascapular nerve can get easily compressed. So it can get compressed easily in the point where it passes below the transverse scapular ligament. Okay, so when it gets compressed, it causes weakness of the supraspinatus muscle and the infraspinatus muscle. It causes supraspinatus weakening and infraspinatus weakening, and you all know, yes, you all know supraspinatus muscle. Okay, supraspinatus muscle, okay, it initiates abduction. So initial 15-degree of shoulder abduction. So initiation of abduction. So you know, you move the arm away from the body, that is called as abduction. initiation of abduction. So initial 15 degrees caused by supraspinatus and infraspinatus. Okay, so infraspinatus, yes, infraspinatus, it causes external rotation of the shoulder joint. It causes external rotation of the shoulder joint. It causes external rotation of the shoulder joint. Okay, guys, yes. So it causes external rotation of the shoulder joint. So this is very important area. Questions have frequently come from this area. So each and every point which I said is very important. The suprascapular nerve, branch of upper trunk of brachial plexus, runs below the transverse ligament through a foramen called the suprascapular foramen. It reaches the supraspinatus fossa, supplies the supraspinatus muscle, okay, and it passes through the spinoglenoid notch and it supplies the infraspinatus muscle. Function of supraspinatus muscle, initial 15 degree of abduction of the shoulder joint. Function of infraspinatus muscle, external rotation of the shoulder. Very important point. Okay, fine. With this we'll go to the next nerve from the trunk. The next nerve which arises from the trunk of the brachial plexus is nerve to subclavius. Nothing much about this nerve. Okay, this nerve supplies a small muscle below the clavicle. Okay, can anybody tell me what is the muscle which is supplied by nerve to subclavius? Okay, see, nowadays these questions are like crorepati questions, okay, where you can ask a very simple question like nerve to subclavius supplies which muscle. Okay, nerve to subclavius supplies which muscle. Everybody can answer, isn't it or not? But these kind of questions will not come in exams. Okay, slightly complicated question comes from the exams. Okay, I will tell you what complicated thing you get from this area. Okay, so nerve to subclavius supplies subclavius muscle, nothing much about it, but very carefully you listen. If you see the nerve to subclavius, okay, if you see the nerve to subclavius, okay, it has got root value of C5 and C6. Okay, suprascapular nerve also has got root value of C5 and C6. Nerve to subclavius also got a root value of C5 and C6. Okay, can anybody tell me what is the nerve supply or what is the root value of phrenic nerve? Can anybody tell me what is the root value of phrenic nerve? Yes, just now we saw what is the root value of phrenic nerve. Yes, very good. It is C3, C4 and C5. Very good, guys. It is C3 and C4 and C5. Now what happens is, in some persons, from the nerve to subclavius, the C5 root can go and join the phrenic nerve. Okay, so please listen very carefully. Very important point. From the nerve to subclavius, the C5 root, okay, from the nerve to subclavius, the C5 root can go and join the phrenic nerve. When such a nerve root from the nerve to subclavius joins a phrenic nerve, we call this nerve as accessory phrenic nerve. Okay, this question have come in the INICET exams. Okay, what is the root value for accessory phrenic nerve? Can anybody tell me what is the root value for accessory phrenic nerve? Yes, very good. It is C5. Very simple now. But where does it arises? From which nerve it arises? This accessory phrenic nerve arises from nerve to subclavius. So what is the use of this accessory phrenic nerve? Even if phrenic nerve is damaged, even if there is a compression of the phrenic nerve, or even if there is an avulsion of the phrenic nerve, which can happen, this accessory phrenic nerve will supply the diaphragm. So please remember, accessory phrenic nerve, root value is C5. From where does it arises? It arises from the nerve to subclavius. Okay, nerve to subclavius arises from where? Nerve to subclavius arises from the upper trunk of the brachial plexus. Very good, Bhavadharani, and very good Achis, very good. So you guys are great and you are doing very good. So phrenic nerve root value is C3, C4 and C5, whereas the accessory phrenic nerve root value is C5. Okay, so these are the branches which arises from the trunk of the brachial plexus. And when you see the middle trunk, and from the lower trunk there are no branches. No branches are seen from the middle trunk and from the lower trunk. Okay, now coming to the divisions, as we have seen previously, no branches arises from the divisions. Okay, if somebody asks you what is the part of the brachial plexus that does not give rise to any branches, you can straightforward give the answer, it is the division part of the brachial plexus. From the divisions, no branches. Okay, so we have seen the formation of the cards from the division, and we have seen how the lateral cord is formed. Lateral cord is formed by the union of the anterior division of the upper trunk and from the anterior division of the middle trunk, and from the lateral cord you have got three nerves which arises. Okay, so we can have a simple mnemonic for it. Okay, we can have a simple mnemonic for it. Okay, so we can have a simple mnemonic like Lata loves music. Okay, LLM, we can have a simple mnemonic like this, Lata loves music. Yes, so L stands for lateral root of median nerve. L stands for lateral root of median nerve. Okay, and okay, another L stands for lateral pectoral nerve. Another L stands for lateral pectoral nerve, and M stands for musculocutaneous nerve. M stands for musculocutaneous nerve. Okay, so these are the three nerves which arises from the lateral cord of brachial plexus. So one is the lateral root of median nerve, lateral pectoral nerve, and musculocutaneous nerve. Okay, of this the musculocutaneous nerve has got root value C5, C6 and C7, very important nerve from the lateral cord of brachial plexus. Very important nerve from the lateral cord of brachial plexus. So from the medial cord of brachial plexus, 5 nerves arises, and you can have a mnemonic like this: more money makes men unhappy. You can have 4M and 1U, or you can have this mnemonic which is very apt to nowadays: more money makes men unhappy. Okay, so more money makes men unhappy is the mnemonic for this. Okay, so more money makes unhappy. So what is the first M stands for? First M stands for the medial root of median nerve. Okay, so first M stands for the medial root of the median nerve. Yes, the next M stands for the medial pectoral nerve. So next stands for the medial pectoral nerve, and the next M stands for the medial cutaneous nerve of the arm, and the next M stands for the medial cutaneous nerve of the forearm. Okay, the last U stands for, yes guys, it is the ulnar nerve. Yes, so these are all the branches which arises from the medial cord of brachial plexus. Am I clear in this? So 4M and 1U. So of this, the very important nerve is ulnar nerve, which has got root value again C8 and T1. It has got root value C8 and T1. Yes, next is the posterior cord of brachial plexus. So there are again 5 nerves which arises from the posterior cord of brachial plexus, which goes by the mnemonic ultra. You can have this mnemonic as ultra. Okay, you can have this mnemonic as ultra, and where U stands for the upper subscapular nerve. Okay, U stands for upper subscapular nerve. U stands for upper subscapular nerve. Okay, L stands for lower subscapular nerve. Okay, L stands for lower subscapular nerve. Yes, T stands for, can anybody tell me what does T stands for? Very simple. Yes, T stands for, guys, what is the letter T stands for here? T stands for thoracodorsal nerve. Yes, it is thoracodorsal nerve. Yes, it is thoracodorsal nerve. Thoracodorsal nerve is also called as nerve to latissimus dorsi. It is also called as nerve to latissimus dorsi and supplies the latissimus dorsi. And the next nerve which arises from the posterior cord is the radial nerve, and the last nerve which arises from the posterior cord is the axillary nerve. So these are all the nerves which arises from the posterior cord of brachial plexus. All these are given in the subsequent pages, no need to write also, just listen to this. So you got 3 cords of brachial plexus: lateral cord, medial cord and posterior cord, and we have seen the branches which arises from these cords. Okay, so these are all the main branches which are arising from the brachial plexus. These are all the main branches which arises from the brachial plexus. We'll discuss about these branches in detail one by one when we go to the subsequent part of the classes. Okay, so as of now, the take home message is the brachial plexus is divided into supraclavicular portion and infraclavicular portion. So please remember, roots and the trunks are the supraclavicular portion, whereas the cords and the branches are the infraclavicular portion or the infraclavicular portion. Very good, fine. Okay, now how does this brachial plexus enters the supraclavicular region? Can anybody tell me how the brachial plexus enters, between what muscle it enters? Yes, anybody? So this brachial plexus enters the supraclavicular region between two muscles. Okay, so the muscles which are lying around the brachial plexus are, one is scalenus anterior, another one is scalenus medius. Scalenus anterior and scalenus medius. Between these two muscles, the brachial plexus enters the neck region. Okay, so this is about the brachial plexus, guys. So we have seen all this. Yes, so upper trunk, you know what are the two nerves which arises from the upper trunk, and middle trunk there are no branches, and from the lower trunk there are no branches, and the cords you have seen about the branches which arises from the cords also. Okay, so we have seen all this. Yes, so we'll go to the next page of the brachial plexus. Yes, very good. So whatever we have discussed are given in the next page. So branches from the root are these two. Can anybody tell me what is the root value for dorsal scapular nerve, guys? Anybody? What is the root value for dorsal scapular nerve? Yes, again it is C5. Very good, it is C5. Now what are all the muscles which are supplied by dorsal scapular nerve? The muscles which are supplied by the dorsal scapular nerve are rhomboides major, yes, rhomboides minor, and levator scapulae muscles, Okay, so dorsal scapular nerve supplies these three muscles: rhomboides major, rhomboides minor, and levator scapulae muscles. Please remember, guys, levator scapulae, in addition to this, it is also supplied by C3 and C4 nerve roots. That is why levator scapulae is also called as an hybrid muscle. It is also called as an hybrid muscle. Okay, so there are lot of hybrid muscles. Okay, so the lot of hybrid muscle. One muscle is levator scapulae. Okay, can anybody tell me a few other examples for hybrid muscle? When two different nerves supplies a muscle, we call that as an hybrid muscle. Yes, so there are few other muscles in the body which are called as an hybrid muscle. For example, brachialis is called as an hybrid muscle. Okay, brachialis is called as an hybrid muscle. Very good. Okay, flexor digitorum profundus is called as an hybrid muscle. Yes, flexor digitorum profundus is called as an hybrid muscle. Pectineus is called as an hybrid muscle. Yes, pectineus is called as an hybrid muscle. Very good, Bhavadharani. Adductor magnus is called as an hybrid muscle. Okay, what is hybrid muscle, guys? When two different nerves supplies a muscle, we call that muscle as an hybrid muscle. These are all few examples for hybrid muscle. One is levator scapulae, brachialis, flexor digitorum profundus, pectineus, adductor magnus are all few examples for hybrid muscles, Okay, so this is about the dorsal scapular nerve. Dorsal scapular nerve supplies three muscles: rhomboides major, rhomboides minor, and levator scapulae. Yes, very good. Yeah, I think you are understanding my words. Am I clear? So am I going slow or fast, or this pace is okay for you, guys? Yes, can you able to write what I am telling you? See, all these points are very important. Okay, so we have come across these questions very frequently in the exams. So we are not discussing any unwanted points. All the points have been repeated in the previous year questions. So please pay your attention. Each and every point is very important. Okay, fine. Yes, so we are going to the next part, that is the long thoracic nerve. Yes, we all know the long thoracic nerve root value C5, C6 and C7. Yes, Long thoracic nerve is also called as nerve of Bell. Long thoracic nerve is also called as nerve of Bell, and it supplies the serratus anterior muscle, and it supplies the serratus anterior muscle, and it supplies the serratus anterior muscle. Yes, it supplies the serratus anterior muscle. Okay, it supplies the serratus anterior muscle. Okay, fine. So it supplies the serratus anterior muscle. So serratus anterior muscle is a muscle which causes two actions. Okay, we'll discuss those things in the further course of the classes. Just to highlight serratus anterior causes two actions. One, it causes protraction of the scapula. Once it causes protraction of the scapula, and next it helps in overhead abduction of the shoulder. Next, it helps in overhead abduction of the shoulder. Okay, very very important muscle, serratus anterior. Serratus anterior causes protraction of the scapula. So what is called as protraction of the scapula? Just imagine you bring your two hands forward. Okay, so your scapula moves around the chest wall anteriorly. So when you bring your two hands forwards, the scapula moves around the chest anteriorly. That action is called as protraction. So where do you see this action? So sometimes when the boxers, when they punch, okay, so their action is like this. So the scapula protracts. So for boxing, this protraction is very very important. That is why serratus anterior is also called as boxer's muscle. That is why serratus anterior is also called as what? Boxer's muscle. Okay, so for protraction of the scapula, serratus anterior is very very important. Where this protraction is important, this protraction is very very important in boxing. So that is why serratus anterior is also called as what? Boxer's muscle. That is why serratus anterior is also called as boxer's muscle. Okay, and also remember, very very important point, serratus anterior along with the trapezius muscle helps in overhead abduction of the arm. Okay, so what is overhead abduction? My arm is here. When I lift my arm just towards the head region, this is called as overhead abduction. Okay, beyond 90 degree, very very important. Beyond 90 degree, what are the two muscles that helps in overhead abduction of shoulder? One is serratus anterior, another one is trapezius muscle. We will come across these muscles again and again. I will repeat these points again and again because this has to be reinforced. You have to understand and you have to keep it in your memory. Very very important points. For overhead abduction, two muscles are important. One is serratus anterior, another one is trapezius muscle. Okay, yes. Nerve to subclavius, we have discussed a lot about nerve to subclavius. It supplies the subclavius muscle. It has got a root value of P5. And this nerve to subclavius gives rise to the accessory phrenic nerve. Suprascapular nerve root value, again it is C5 and C6. Okay, nerve to subclavius root value C5 and C6. Yes, suprascapular root value C5 and C6. It supplies two muscles. One is the supraspinatus muscle, another one is the infraspinatus muscle. Yes, so these are all the branches which arises from the roots and the trunks of the brachial plexus. Okay, fine. Now coming to the branches which are arising from the cords, we have seen this, you have written this in the previous page. So just to revise, from the lateral cord, musculocutaneous nerve, lateral pectoral nerve and lateral root of median nerve. Remember the root value for musculocutaneous nerve C5, C6 and C7. Of the C7 root value for musculocutaneous nerve is very very important. C7 root value for musculocutaneous nerve is very very important. Okay, the medial cord of brachial plexus, yes, 4M and 1U, more money makes man unhappy. Medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve and ulnar nerve. Okay, I am just rushing here because we have discussed this in the previous few minutes, so no need to worry about these things. So upper subscapular nerve, lower subscapular nerve, nerve to latissimus dorsi, also called as what? It is also called as thoracodorsal nerve. Axillary nerve and radial nerve are the branches which arises from the posterior cord of brachial plexus. brachial plexus. So these are all important branches from the brachial plexus. Okay, now when we come to the brachial plexus, okay, so few applied aspects of brachial plexus is very important. Okay, so one thing related to brachial plexus is the Erb's palsy. Okay, so before going into that, we'll just see this picture. Okay, we'll just see this picture. Okay, so what happens here, see, either if a person falls upside down or during the delivery time when the child is pulled out of the mother's body by cephalic presentation. Okay, now what happens is, if you see in both these areas, there is an increased angle between the head and the shoulder. So there is an increased angle between the head and the shoulder happens. So what happens basically here, hyper abduction of the neck happens. Okay, so either you pull the child out by holding the head, or when the person falls upside down, the angle between the head and the shoulder increases. So what happens basically, you got hyper abduction of the neck region. So what is the mechanism here? This is hyper abduction of the neck. Okay, this is hyper abduction of the neck. Okay, so when there is an hyper abduction of the neck, you can see the brachial plexus which are coming from the neck to the shoulder and to the arm region. It has got three trunks: upper trunk, middle trunk and lower trunk. So the upper trunk gets more stretched because of this hyper abduction. So that causes a palsy called as Erb's palsy. So what is happening in Erb's palsy? It is because of the hyper abduction of the neck. The upper trunk region is affected and it causes a palsy called as Erb's palsy. Erb's palsy is also called as obstetric palsy. Erb's palsy is also called as obstetric palsy. Very commonly seen in OG practice. Okay, so that is why it is also called as obstetric palsy. It is also called as obstetric palsy. Guys, see, whenever you stretch a nerve, the nerve gets injured, isn't it or not? So you should know that there are certain kinds of nerve injuries. Okay, so if you take the nerve injuries, I'm not going into any details of nerve injuries now. That will take the class very far away from the current area. So just to tell you, nerve injuries. Okay, nerve injuries, if you see nerve injuries, okay, there are two classification systems for nerve injuries. One is called as Seddon classification. Can anybody tell me the other classification of nerve injury? What is the name for the other classification of nerve injury called as? Yes, guys, anybody? I am waiting for your answer. What is the other classification which is used for? Very good, Rajanandini, very good. Subita and Sabrina, very good. So other one is called as Sunderland classification. Another one is called as Sunderland classification. Very good, guys. See this Seddon classification. I am just sticking with Seddon's classification because it is appropriate to discuss about Seddon classification now. Seddon classification, they classify the nerve injury into three types. One is called as neuropraxia. One is called as what? Neuropraxia. Okay. Next one is called as axonotemesis. The last one is called as neurotemesis. Okay. Now when you talk about Seddon's classification, so there are three types in it. One is called as neuropraxia, next one is called as axonotemesis, the next one is called as neurotemesis. Of this, the neuropraxia is what happens in brachial plexus injury, and in neuropraxia there is no anatomic discontinuity. So neuropraxia, what is important in neuropraxia? No anatomical discontinuity of the nerve. There is no anatomical discontinuity. Okay, there is no anatomical discontinuity of the nerve. Okay, what is happening here is there is only physiological disruption of the nerve signal transmission happens. There is only physiological disruption happens. There is no anatomical discontinuity. Very, very important. The nerve is not cut into two pieces. The nerve is not disconnected. Only the transmission is temporarily stopped in neuropraxia. Transmission is temporarily stopped in neuropraxia. Why it happens? It happens because of the stretching of the nerve. It happens because of the stretching of the nerves. So what is happening in Erb's palsy? When you hyperabduct the neck, the three trunks, the upper trunk is stretched more. So that is why the upper trunk gets stretched and it causes neuropraxia, and that neuropraxia is also called as Erb's palsy, also called as obstetric palsy. See, this is very, very important question. Many times they have asked, what is the kind of nerve injury seen in Erb's palsy, whether it is neuropraxia, axonotmesis or neurotmesis. So what is present here? It is the neuropraxia kind of injury. And what is the importance of neuropraxia? There is no anatomical discontinuity, only physiological disruption. Only physiological disruption of the nerve supply happens. So please remember, guys, in neuropraxia, please remember, guys, in neuropraxia 100% recovery is possible. 100% recovery. Okay, so the nerve will recover 100%. Most of the times 100% recovery is possible. So if somebody asks you, so in Erb's palsy, will there be good recovery or won't there be any good recovery in Erb's palsy? Okay, so Erb's palsy usually happens. Okay, it has good recovery. It has got good recovery. Okay, so what is the kind of nerve injury that happens in Erb's palsy? If somebody asks you, you can say very well now, it is neuropraxia. Okay, so Siddon's classification, remember. So you should know about neuropraxia, you should know about axonotmesis, and you should about neurotmesis. Okay, so we'll discuss about neurotmesis and axonotmesis in the further course of this class. As of now, just remember, neuropraxia, it is only physiological disruption, no anatomical discontinuity, and the recovery is 100%. Okay, fine. Now coming to Erb's palsy. See, when you talk about Erb's palsy, guys, Erb's palsy is the area where the nerve gets stretched in the region of the upper trunk at a point called as Erb's point. Now, what is called as Erb's point? Very, very important. Erb's point is the point, or it is the meeting point of six nerves. It is the meeting point of six nerves. Okay, it is the meeting point of six nerves. So that is called as Erb's point. Now, what are the six nerves which meet at this point? So if you see here, the root of the upper trunk, that is the C5 and C6, the suprascapular nerve and the nerve to subclavius, the anterior and posterior division of the upper trunk, they all meet at this point. This point is called as the Erb's point. So what is Erb's point? Erb's point is the meeting point of six nerves. So what are the six nerves? The six nerves are the roots C5 and C6, the suprascapular nerve and the nerve to subclavius, and the anterior division, posterior division. So these nerves join at one point. These six nerves joins at one point. It is this point which gets stretched in brachial plexus palsy, and this point is called as Erb's point. Okay.